Medicine has been influenced by the growth of biomedical knowledge, the technological breakthrough, and the social and health policy developments. The same applies to medical education. In fact, this influence is reflected in the recent medical curriculum reforms, in which the traditional horizontal curricular program is being replaced by the integrative mixed system and disciplines program. So this vertical integration of basics and clinical sciences allows learners to immerse themselves in the clinical aspects of medical curriculum from the beginning of their medical instruction. We performed a comprehensive review of the literature using data from different databases. Our goal was to reflect on anatomy education's state-of-the-art by examining the current pedagogical approaches and strategies used in this field.
As analyzed in our work, the current anatomy education context is characterized by a lot of restraints, namely, decrease of available teaching time, increasing influence of radiology and endoscopy imaging and other invasive and non-invasive medical techniques in the approach to anatomy, low sustainability of the dissecting room or anatomy theaters, a less availability of cadaveric material and difficulties in eliminating the risks associated with its handling, such as toxicity of fixative products, increasing number of medical students, the contractual restraints of teaching staff due to the re-evaluation of the funds distribution between departments, leading to the evident decrease of medical-non-medical teaching staff ratio, along with the shift of anatomy department's agenda from teaching to research activities. Consequently, insufficient anatomic knowledge compromises such important aspects of the clinical practice, such as the correct and efficient identification of anatomical structures in medical imaging, surgical procedures, or physical examination.
The use of technology-based methodologies in anatomy education is becoming a common solution for the stated challenges. In our work, we reflect on the new human body visualization approaches, as in the case of CT and MRI reconstructions. Also, learning experiences have been influenced by social interactions. In fact, social media networks are paving their way into anatomy education. For instance, we explore the experiences with image and video databanks. We also evaluate the impact of e-learning platforms by analyzing the role of learning management systems and computer-based platforms. Finally, we prospect the future pedagogical approaches, which by this point seem to be heavily technology-based. Here, we reflect on the introduction of virtual reality systems, learning analytics principles, and artificial intelligence technology.
Anatomy, as the basis of clinical education, allows the creation of a student-centered culture and use of technology-based methodologies which can promote different educational approaches, as is the case of blended learning. The results obtained in our research allow to advance that a multimodal approach based on technology for anatomy education, introduced from the early beginning of the medical course, copes with more recent pedagogical views in medical education.